Good evening, everyone. My name is Stephanie Vink, and I serve as the Product Development Specialist for the Summer Health Professions Education Program, aka SHPEP. For those of you who are unaware, SHPEP is a six free summer enrichment program, 6 weeks free summer enrichment program for eligible college freshmen and sophomore students who are interested in the health professions. Our application will open November 1st. To learn more, please check out shpp.org. I'll now turn it over to our presenters to discuss how you can qualify for some National Health Service Corps financial awards. Melissa Robinson and Sabrina Lynch, please feel free to take away these. Thank you.
Thank you so much, Stephanie. Good evening, everyone, and welcome to the Summer Health Professions Education Program webinar from the National Health Service Corps Program Overview. I am Sabrina Lynch, a Supervisory Management Analyst with the National Health Service Corps, and I will be presenting to you this evening alongside my colleague, Melissa Robinson, from the Loan Repayment Branch. Next slide. Before we get into details about the National Health Service Corps loan repayment programs, I would like to provide a brief overview about the National Health Service Corps, known to many as the NHSC. The NHSC is administered by the Bureau of Health Workforce, or BHW for short. This bureau is within the Health Resources and Service Administration, also known as HRSA. Funding from the Bureau supports the National Health Service Corps and other programs that are designed to improve the distribution of health professionals to underserved areas. Our purpose is to build healthy communities by providing financial awards to primary care, medical, dental, and behavioral health care providers who are committed to serving in the nation's underserved communities. Every year, HRSA programs serve tens of millions of people, including people living with HIV/AIDS, pregnant women, mothers and their families, and those otherwise unable to access quality health care. Throughout the years, we have provided clinicians with scholarships and loan repayment awards and are proud to support communities who recruit and retain quality care clinicians committed to providing care where the need is greatest. Next slide. Most recently, the program's field strength increased to a historic number, nearly 20,000, with the addition of $800 million in funding from the Biden-Harris administration's American Rescue Plan. The NHSC has expanded and adapted its clinician support to address public health crises that directly relate to its mission and to provide quality medical, primary care, dental, and behavioral health care. This 50th anniversary provides the Corps, its alumni, members, and stakeholders an opportunity to reflect on the impact that more than 66,000 NHSC clinicians have had on the lives of millions of people, health equity, and the care of our nation. Next slide. Over the course of this presentation, we are going to touch on such topics as our program overview, eligibility requirements of the Students to Service or S2S loan repayment program, the financial benefits of being a S2S participant, the application process, postgraduate training options, and the service commitment of those of S2S and our other partner NHSC programs. Next slide. So looking at the NHSC paradigm, we have 4 recruitment and retention methods that are committed to identifying a skilled primary care workforce and placing them in areas where they are needed most. Next slide. Now we will share information about our NHSC student programs. Students must be pursuing a degree in medicine, allopathic or osteopathic, a degree in dentistry, or a postgraduate degree or postgraduate certificate from an accredited school or program in nurse midwifery education, physician assistant education, or nurse practitioner education, specializing in adult medicine, family medicine, geriatrics, pediatrics, psychiatric mental health, or women's health. Next slide. In exchange for the scholarship award, NHSC scholars commit to practice a minimum of 2 years at an NHSC approved site upon graduation and completion of training and licensure. Next slide. NHSC scholarship program applicants must be a U.S. citizen or a U.S. national. Full-time students must be enrolled or accepted to a fully accredited program as stated by the NHSC S2S loan repayment program for the following programs, either MD or, we use acronyms and I apologize for that, for allopathic or osteopathic physicians, dentists, nurse practitioners, certified nurse midwives, or physician assistants. Students are eligible to apply during their last year of their academic study. Next slide. Service begins upon graduation and completion of any required primary care residency. The NHSC works with the scholars to find a practice site that's right for them. Each scholar receives up to $1,200 to conduct all on-site interviews. Scholars may qualify to receive a one-way relocation support to assist them with the initial placement to begin their service in their new community. When in service, scholars receive a competitive salary paid by their site. Scholarship recipients who remain at an NHSC site after completing their service and have remaining qualifying educational debt can apply to the traditional NHSC loan repayment program. Next slide. Now let's talk about our Students to Service loan repayment program. The NHSC offers up to $120,000 in tax-free loan repayment for 3 years of full-time service or 6 years of half-time service. Awards are paid in 4 equal annual installments beginning in August of your award year. Once your initial service commitment has been completed, program participants can apply for continuation contracts, which may allow you to pay off all of your student loans. Next slide. To be eligible for the NHSC Students to Service loan repayment program, medical doctor applicants are required to be a U.S. citizen or U.S. national. You must be enrolled full-time and in your last year at an accredited school pursuing one of the following eligible degree programs. Physicians in allopathic or osteopathic medicine must complete an accredited primary medical care residency at an NHSC approved site in a specialty such as internal medicine, family practice, pediatrics, OB/GYN, psychiatry, or geriatrics. Dentists are encouraged but not required to complete an accredited postgraduate training at an NHSC approved approved site specializing in general practice, advanced education in general dentistry, pediatric dentistry, public health dentistry, or a geriatrics dentistry fellowship. Our nurse practitioners, certified nurse midwives, and physician assistants are also encouraged but not required to complete an accredited postgraduate training at an NHSC approved site. A one-year postgraduate training in primary care specialty is approved. Next slide. Now let's hear from Dr. Freeman, an NHSC Students to Service Loan Repayment Program awardee. Play the video, please.
I went to college and wanted to do biomedical engineering. But it wasn't until my third year of medical school that I got out into the communities where I actually saw patients, that I saw that I really had a love for this type of medicine, for primary care. And so for me, it was a decision, what is it that I really wanted to do? My heart was in the primary care. I'm Brian Freeman, NHSC Student to Service Loan Repayment recipient. Right now, I'm a third year family medicine resident here at Fairfax Family Practice. I'll be looking forward to start my service commitment. My immediate goal is to get into an environment with the National Health Service Corps that I can see myself in for longer term. I actually look forward to it because working with underserved populations, you get to see things with these populations that you don't see in affluent populations. And how long were you congested for when you were pregnant? Especially in primary care, you need to be able to communicate with the wide range of people from all different socioeconomic backgrounds and conditions. Right. Have fun with those babies.
All right, thanks.
Underserved communities means to me working with these people to fill a gap, to allow them to have good health care just like anyone else would. In primary care, especially family medicine, we are their one-stop shop for about 90% of their health care needs. We say it all the time here in family medicine, it's that relationship that you have with the patients. And it's cliche, but it's not really cliche. Because if you have a good relationship with the patient, you can stave off a lot of healthcare concerns that the patient has. Up on your toes and down. Good primary care is primary care that you are actively involved and are the patient advocate.
Great, doctor. Thank you very much.
Primary care has that challenge and how to attract people to come to the field when student loans is such a big issue. And that's why this program is so great, the National Health Service Corps. Money is a consideration for 100% of our medical students in this country. I like primary care, but I'm not going to make enough money to pay off my loans. This new program by the National Health Service Corps is called the Students to Service Program, which was great because it wasn't a scholarship program where you had to be committed to it in med school. It's something that you can apply during your fourth year when you're already applying to residency anyway. And so for those of us who are applying to primary care fields, this program is excellent because it gives you the ability to practice what you love to do, but then not have that financial burden associated with it. I thought it was perfect. When I got the email saying that I had received one of the awards, $113,000. It literally was a huge sigh of relief because now I recognize, man, my financial burden is almost gone. Last month, we welcomed my first child, a daughter, to the world. Her name is Amaya, and she's been a great joy for us. A lot of work, but a lot of joy. I know now that we can start saving for her college education, thinking about getting a house when I get out of residency as opposed to staying in apartment living for several years afterwards. And so it really just frees us up to do the things that we like to do. The benefit of being in the National Health Service Corps is seeing the widest possible range of patient populations, of disease states, of clinical conditions, of socioeconomic backgrounds. That will make you able to be a better communicator, a better leader, a better administrator, because you have a wide range of experience. It's a good way to give back to my community that's helped me growing up. Personally, I can say that a lot of my family, my cousins, my extended family, my grandparents, and my parents when they were growing up too, are underserved. They're from rural or very urban inner city communities where the access to healthcare is not good. I get to serve this population who do a lot for all of us. I only feel it appropriate for us to help them with their health care as well.
Thank you, Dr. Freeman, for those words regarding our Students to Service Loan Repayment Program. Now let me share with you some of our frequently asked questions from our applicants. What types of loans are eligible for the S2S loan repayment program? Well, your qualifying educational loans are government and private student loans, which includes the applicant's undergraduate as well as graduate education. Next slide. You may ask, how long do I have to find a job after I graduate? Well, the NHSC S2S Loan Repayment Program gives our participants 6 months following graduation from school or the completion of your approved postgraduate training to find a site. You can learn more about program guidelines at nhsc.hrsa.gov/S2S-LRP. Next slide. You may also ask, are you able to receive help in finding a job after graduating residency? Absolutely. HRSA has regional advisors who will assist our awardees with job search, and we also cover some traveling costs to interviews. Next slide. You may also be asking, is your discipline eligible for the National Health Service Corps Students to Service Loan Repayment Program? And for that, you must be in your final year of medical, dental, or nursing school and plan to become licensed to provide care in one of the following disciplines: physicians for allopathic or osteopathic medicine, physician assistants, nurse practitioners, certified nurse midwives, and dentists. Next slide. And finally, when will my award be paid? The National Health Service Corps Students to Service Loan Repayment Program Award is paid in 4 equal annual installments of up to $30,000 per year. You can learn more about our program and guidelines on our website. At this time, I would like to turn the remainder of our presentation over to my colleague, Melissa Robinson.
Thank you, Sabrina. Go to the next slide, please. Yes, thank you. The NHSC Loan Repayment Program provides financial assistance with repaying outstanding educational loans to licensed healthcare professionals in exchange for a commitment to provide primary care services in rural and underserved communities. Next slide. The loan repayment programs help remove financial barriers and creates opportunities for clinicians to provide care in high-need areas. Awardees will receive tax-free dollars to repay their educational loans in exchange for 2 or 3 years of service commitment and the option to work full-time or half-time at an NHSC-approved site. Another benefit is the option to count a limited number of teaching hours towards your service obligation. This will vary by discipline. Next slide. The goal of the NHSC loan repayment programs are to recruit and to retain primary care and behavioral health professionals in underserved areas. For our traditional loan repayment program, we offer up to $50,000 for an initial 2-year service obligation. For our substance use disorder loan repayment program, clinicians may receive up to $75,000 in return for a 3-year service commitment at an NHSC-approved SUD treatment facility. Clinicians working at an approved SUD treatment facility may receive priority if they have a Data 2000 waiver, serve in an opioid treatment program, or have a certification in substance use disorder interventions, such as a master's level substance use disorder counselor. For our rural communities loan repayment program, we focus on the expansion of improving access to quality opioid and substance use disorder treatment in rural areas. We will award up to $100,000 for a 3-year service commitment. You can only apply for one program at a time. For the latest information and to sign up for email updates, please visit our website at www.nhsc.hrsa.gov. Next slide. For our traditional loan repayment program, we give priority to communities of high need with higher HPSA scores. HPSA scores are areas where there is a shortage of access to medical, dental, and mental health care. Through the participation of our programs, providers will have the ability to pay off all their qualifying educational loans. Specifically for the traditional 2-year program, participants are able to apply for a 1-year continuation award versus having to complete their entire contract and reapply as a new applicant. Next slide. A benefit of participating in our program is that providers are able to maintain their salary on top of the loan repayment award. The award should not be considered as part of when you're establishing your pay. The NHSC has a dedicated platform called the Health Workforce Connector, where providers can find sites and employment opportunities at NHSC approved sites. We encourage you to take the time to visit our YouTube channel called HRSA Tube. Our YouTube channel features short stories that may serve as a resource for you, such as how NHSC awards are calculated, along with member stories from participants who have completed the different NHSC programs. Next slide. To be eligible to apply for the traditional 2-year NHSC loan repayment program, you must be a United States citizen or national. You must be a provider working at an NHSC approved site or have accepted employment at the approved site. You must have unpaid federal or private school loans that cover tuition, books, or other reasonable education costs. And you must have a professional license to practice within the state where you will be working. Several examples of eligible disciplines are a physician, a primary care nurse practitioner, certified nurse midwife, dentist, this would be general or pediatric, psychiatrist, or a licensed professional counselor. This also applies to licensed mental health counselors. Next slide. For the SUD program, we offer up to $75,000 for a 3-year full-time service contract and up to $37,500 for a 3-year half-time service contract. Unlike the 2-year loan repayment program, the substance use disorder loan repayment program does not offer a continuation contract, but you are able to finish your contract and reapply for the SUD loan repayment program. All applicants must be trained and licensed to provide substance use disorder treatment at an NHSC approved SUD treatment facility. Next slide. The eligibility requirements for the SUD treatment loan repayment program overall are the same as the traditional. However, we do not accept dentists or registered dental hygienists within the SUD treatment program. Under the SUD loan repayment program, we added substance use disorder counselors, registered nurses, and pharmacists as eligible disciplines. Please note that priority is given to applicants with Data 2000 waivers, those providing care in an opioid treatment program, or have a license or certificate in substance use disorder treatment interventions. Next slide. The Rural Community Loan Repayment Program is similar to the SUD LRP. However, clinicians must be trained and licensed to provide SUD treatment in an NHSC approved rural SUD treatment facility. The award amount for the Rural Community Loan Repayment Program is up to $100,000 for a 3-year service commitment and up to $50,000 for a 3-year half-time service commitment. Next slide. Again, for the Rural Community Loan Repayment Program, overall, most of the eligibility requirements are the same as our traditional program. The Rural Committee also has substance use disorder counselors, registered nurses, pharmacists, and nurse anesthetists as additional eligible disciplines. Please note that the SUD program and the Rural Community Program do not offer loan repayment to dentists and dental hygienists. However, all other disciplines listed above can apply for SUD and Rural Community Loan Repayment Programs. For the Rural Community Loan Repayment Program, priority is given to applicants with Data 2000 waivers, those who are currently providing care in an opioid treatment program at an NHSC approved site, or have a license or certificate in a substance use disorder intervention, such as a master's level substance use disorder counselor. Next slide. For eligible sites, here are a list of the different sites that you can work at while participating in our program. I will not go through the entire list, but sites can be federally qualified health centers, community outpatient facilities, Indian health service facilities, correctional or detention facilities, or SUD treatment facilities. Next slide. At this time, we will go over some valuable resources available to you. We have the Health Workforce Connector, which helps connect NHSC applicants and members with job openings at approved sites and facilities. There is a feature of Google Mapping that allows for in-depth review of the local community surrounding your potential work site. Job seekers and approved sites can use the Health Workforce Connector to easily search for and find eligible matches for specific disciplines, HPSAs, and locations. The connector is mobile friendly and offers keyword search capabilities with advanced filtering. Next slide. Within the Health Workforce Connector, you will be able to create a professional profile. You can upload resumes, your credentials, and licenses. The connector is available to any provider, regardless of program affiliation, who wishes to practice in a community with limited access to medical, dental, and behavioral health services. Next slide. Our virtual job fairs are free online events that connect primary care trainees and practicing clinicians with NHSC approved sites with job openings. During the job fair, you can learn about medical, nursing, dental, and behavioral health job openings directly from the healthcare facilities. The next job fair will take place on Wednesday, November 16th from 6 to 9:30 p.m. Eastern Standard Time. Next slide. Okay, so a reminder, for our Students to Service Loan Repayment Program, we are currently accepting applications and the deadline to apply is December 21st oh, I might have this wrong, December 1st at 7:30 p.m. Eastern Standard Time. We have 2 upcoming Q&A sessions. Session 1 takes place on November 8th from 10 a.m. to 5 p.m. Eastern Standard Time. And session 2 takes place on November 22nd from 10 a.m. to 5 p.m. Eastern Standard Time. Next slide. There are many ways to connect with NHSC, including our customer care center that is open Monday through Friday, 8 a.m. to 8 p.m. Eastern Standard Time. Please remember to visit the Health Workforce Connector to search for all NHSC approved sites and job openings, and to stay tuned for virtual job fairs that we hold periodically throughout the year. To get full details about our programs, how to apply, please visit the NHSC website, www.nhsc.hrsa.gov. Next slide. We encourage you to follow us and share our content on Twitter, Facebook, LinkedIn, and Instagram to stay up to date on the latest HRSA news. Our account handle on each platform is @HRSAGOV. Additionally, we also encourage you to sign up for HRSA's e-news. This is a bi-weekly email of comprehensive HRSA news, and to sign up for HRSA press releases. You can also visit www.hrsa.gov for more detailed information about agency-wide programs. Next slide. Okay, at this time, we will now begin our question and answer session. Please add your questions to the Q&A box, and we will answer questions aloud for everyone to hear.
We have our first question from Aya. They have 2 questions. Can someone still apply to the NHSC even if they are not a primary care physician or dentist, such as a pediatric cardiothoracic surgeon? And then their follow-up question is to confirm if someone of that discipline would be eligible for the S2S LRP.
Hi, this is Sabrina Lynch with the Scholarship and Students to Service Loan Repayment Program. So I just wanted to address this and refer to page 7 of our application and program guidance. I do believe a copy has been uploaded into our chat for the attendees to view. However, the eligible disciplines for physician assistants would be adult medicine, family medicine, pediatric medicine, women's health, geriatrics, and psychiatry and mental health. So unfortunately, I'm going to pronounce it incorrect, cardiothoracic surgery would not be listed as an eligible discipline for physicians or physician assistants. However, that may be a program that you can look to one of our other loan repayment programs for, such as our traditional loan repayment program, but not for students to service.
Thank you. Our next question is from Simona. Can green card holders also apply?
Thank you so much for asking that question. Again, and a lot of my answers will come directly from our application and program guidance because I love verifiable information. So it's not as if I'm just giving you information, but I'm giving you the reference of where you can locate it and see it in our application and program guidance. But on page 39, the proof of status of U.S. citizenship or national that's required would either be a birth certificate or a certificate of naturalization or a passport. For a permanent resident card, a driver's license, marriage certificate, or a social security card are not acceptable forms of documentation.
Our next question is from Quinn for physician assistants. Are you required to work in primary care, or is just the training that is required?
So once again, I'll refer to our application and program guidance, which identifies the disciplines that are eligible for physician assistants. And so our physician assistants are eligible to work in adult, family, pediatric, women's health, geriatric, or psychiatry and mental health.
Our next question is from Vanessa. The suggested / encouraged postgraduate training for dentists, does it count towards the years of service?
The postgraduate training for all of our disciplines would not count towards their years of service. If you would refer to page 23 of our application and program guidance, there it will give you more detail regarding your start of your service obligation. And so your service obligation would actually begin upon completion of an approved postgraduate training program.
Next, Sarah asks, when does the application open?
Great question. The Students to Service Loan Repayment application is currently open. We are open. We are scheduled to close on Thursday, December the 1st, 2022 at 7:30 p.m. Eastern Time. So please take a look at our application and program guidance so that you can gather your required documents and get your application submitted.
Next, an anonymous attendee asks, for the upcoming cycle, do you expect to have enough scholarships for all eligible dental applicants like HRSA did in 2021?
Did you want to clarify for which upcoming cycle, anonymous attendee? I could speak to one of our programs, but I don't want to assume.
I believe they're referring to the NHSC scholarship program.
Okay, great. Thank you. For the National Health Service Corps Scholarship Program, we do expect to have enough scholarships available for all eligible dental applicants.
Okay, next, Yenna asks, when can we start applying for the scholarship? I am applying to dental school next cycle. Will I apply to the scholarship next cycle?
Absolutely. So the scholarship program will open in spring of 2023. So I would encourage you to sign up on our website at nhsc.gov to become a part of our mailing list. That way you'll become well informed of when we will start broadcasting prior to the open of the application cycle. We have a great team that does external advertising and will keep you informed via social media and email content of when the scholarship program application cycle will open in spring of 2023.
Next, Lorraine asks, how does one find a community health center or facility HPSA score?
And I don't mind answering all of the questions, but I do want to defer to Melissa. If you want to chime in on anything, just when I see you unmute, I'll know to go ahead and give you the floor.
Yes, well, I can take this one. We actually have the HPSA score information and how to determine that. You can go to our website. I can drop it in the chat just so it's easier to capture real quick for you guys. And there it will go over how we designate the HPSA scores. In addition, you can go on the Health Workforce Connector and look up sites that are, now this is going to be data for sites that have registered with the Health Workforce Connector, but it will have their HPSA score on there as well. So you can also find that information there. And I can drop the link for the Health Workforce Connector as well in the chat.
Okay. Next, an anonymous attendee asks, are dental hygiene programs eligible for the NHSC?
I want to say this might apply to both of us. If you are a registered dental hygienist, so after program graduation, you can apply for our traditional 2-year loan repayment program. And then I'll defer to Sabrina as well.
For the scholarship program, you would have to be a dentist pursuing a DDS or DMD. And for the Students to Service program also. So unfortunately, our dental hygienists, as Melissa stated, are eligible for our traditional loan repayment program.
Next, another anonymous attendee asks, how can we obtain waivers mentioned in the presentation?
Yes, so I'll go ahead and take this. I'm going to assume that you're referring to the Data 2000 waiver. And we do offer the information to get the waiver directly on our website. So you can visit HRSA.gov. Again, we could drop that link in the chat. And then you would register for the class. It's a partnership with SAMHSA that we have for people to take the class and receive the waiver.
Next, Allison asks, does the service commitment have to be completed at one site for the entire 3 years?
I'm going to answer this because I'm looking at the timing. That was when I was speaking. It does not. However, the site that you are working at while in the service obligation, you have to get approved to transfer to another site before you transfer. So if you do it without approval, then it's a strike against you and you're jeopardizing your contract. But you do not have to fulfill the 3-year service commitment at the same site.
And for this, the Students to Service Loan Repayment Program, site changes just have to be approved prior.
Thank you. Next, an anonymous attendee asks, are the applications pretty similar from year to year?
For us, yes, they are. The information, it's always good to read the application program guidance just to see if there have been any changes, something that may have been required. And I'll just use case in point, the use of personally identifiable information. We want to be very careful with that, that you're only answering the questions asked and not including any additional, personally identifiable information there. But are the applications similar from year to year? Yes, they are. There is basic information that is required. If you are applying for scholarship, of course, there are no loan details to be uploaded on the scholarship application. But for the Students to Service and other loan repayment programs, of course, your loan information is required.
And for the loan repayment program for clinicians, the application is generally the same, but we do have changes as we start to explore, or we continue to explore eligible disciplines and funding and various things within that would make somebody eligible for the program. So again, check that every year, but overall, yes, it's the same process.
Next, Allison asked another question. Can we set up one-on-one meetings with a representative?
We refer calls to the call center. However, if you would like to contact our program, we do have a program email box where questions can be answered if you're having difficulties getting your application submitted.
I'll just share that's the same for the loan repayment program. We would ask people to reach out to our customer care center for information.
And I believe that information was also shared in our chat.
Okay. Next, an anonymous attendee asked, are awards for the NHSC scholarship program awarded on a rolling basis?
So the scholarship program is an annual application. So when you say rolling, it's not continuous throughout the academic year. We will open our application cycle in spring of 2023. Final award notices are made by September 30th, 2023. And then we will welcome our new cohort of awardees in the fall. So it is an annual application where you apply in the spring. The application review process does continue for the next couple of months, and final award notifications are made by September 30th of that academic year to welcome the new cohort.
Next, Serena asks, or she says, I would like to enroll in my local dental school's dual enrollment program that offers a DMD and MBA. Does the NHSC scholarship program cover only the DMD tuition and associated costs, or would it cover the MBA as well?
Great question, Serena, and thank you for asking. The National Health Service Corps Scholarship Program would cover only the DMD tuition and costs. Our scholarship awards are up to 4 years. And so for any coursework, any time taken for the MBA, would not be covered by the scholarship award. Our award period is up to 4 years. And so we would cover just the time for the DMD.
Okay. Next, Angie asks, do we have to be accepted into a physician assistant program already to apply for the scholarship, or can the funds be used for postgraduate prerequisite sciences I need to apply the following year? I have a bachelor's in psychology already.
Great question, Angie. Our eligibility requirements state you must be enrolled in a physician assistant program at an accredited facility. The National Health Service Corps unfortunately would not cover prerequisite programs, and your scholarship award would be during the term of your actual attendance at an accredited physician assistant school in their program.
Next, an anonymous attendee asks, they're clarifying an earlier question. When you said you expect to have enough scholarships for all the eligible dental applications for the upcoming NHSC scholarship program cycle, are you saying that as long as you successfully complete the application with all required materials, you will receive it?
Oh, thank you for clarifying. So all eligible applications. So we appreciate that you would complete the application, but please note there are some requirements which are listed in our application and program guidance that must be met. And so because of how our funding is set up, we do review applications and we do have some funding priorities. However, while we state that all eligible applications, we are stating all eligible. And so the fact that it's a completed application, it must meet eligibility requirements.
Okay. Next, an anonymous attendee asked a follow-up question. To clarify, are award decisions made as applications are reviewed until funding runs out, or are all applications reviewed before deciding awards within the application period?
So all eligible applications go through a review process. And when we have a pool of eligible applicants, we do go through a final stage, which is our confirmation of interest. Once the confirmation of interest is verified and the applicant is still interested in the program, awards are based on funding priorities and those who have responded in acceptance to the confirmation of interest.
Next, Carla Marie asks, do you have to attend a medical school in the US?
All programs and schools for National Health Service Corps eligibility must be one of our must be an accredited or a school accredited according to your degree and discipline. So yes, it must be a school within the US or the US and its territories, but yes.
Next, Angie asks, on the registration form for this info session, there was a public health option. Do the scholarship funds pay for public health graduate programs?
Is that for the Students to Service Loan Repayment Program? Just to clarify.
Oh, they mentioned scholarship funds. So I would assume it's for the NHSC scholarship program.
Okay, so does the scholarship program only covers for eligible coursework towards your medical, dental, physician assistant, nurse practitioner, certified nurse midwife degree, not for coursework outside of that degree?
Okay, an anonymous attendee asks, so applying earlier in the application cycle does not make a difference?
While it's not a first come, first served basis for our scholarship program, applying early does get your application in. We don't cut off, reviewing applications. Once the application cycle closes, we review all applications submitted.
Next, Angie asked, or she clarified that she was asking about the Students to Service Loan Repayment Program. Would that cover for public health graduate degree?
I'm sorry, I was looking at this. For the public health graduate degree, that coursework would, if they are, so public health, when we think of public health, there's been coursework wrapped in there. So we pay for eligible coursework towards your degree, but you must be awarding to one of the degree options listed for allopathic, osteopathic, dental, physician assistant, nurse practitioner, or certified nurse midwife degrees.
All right, we've reached our final question. An anonymous attendee asks, knowing that scholarships are awarded after school has started, do we have to begin the payment cycle at our dental school until the scholarship is activated? How is this handled?
Of course. So once an applicant, a scholarship program applicant is awarded and they are notified of award, our award period begins July 1 of the academic year. So for those that were awarded, and I'll take this year as an example, in 2022, their scholarship award became effective July 1, 2022. They were in current summer coursework. We did cover the summer coursework because your contract begins July 1, 2022, and going forward. It is not retroactive back to the beginning of a program if you began your program in prior years. But for the academic year that you are awarded, the contract year begins July 1 of the award year and ends on June 30 the following year. And so it's a yearly award depending on how many years of scholarship you have accepted.
Carla Marie asked one more question. Can you receive a scholarship and loan repayment?
Because our programs come with service requirements, you can only participate in one program at a time. So if you are a scholarship awardee, depending on your degree and discipline, you may have to complete your postgraduate training, then go into service. You then become a funding priority for us should you decide to explore additional National Health Service Corps programs. But currently you must attend and complete one program at a time.
Thank you. We have no more questions in the chat.
Thank you so much, everybody, for joining. That was such a great informational session. Really appreciate your time. And everybody else on the webinar, thanks so much again. And as a reminder for the SHPP program, our application opens up November 1. If you're eligible, we hope to see your application. So have a lovely rest of the evening. And thank you so much. Unless anyone else has anything.
Thank you so much, everyone. Have a good evening.
Thank you.
Goodbye.